This is ABC12's Newsmaker.
Well, nearly 40,000 women died from breast cancer in 2013. It's a startling number, but millions of others survived. Today on Newsmaker, we are going to take an in-depth look at this disease and how it could affect you or someone you love. First, we've invited a breast health navigator and breast cancer survivor to talk about her role in a woman's diagnosis and her own experience with cancer. We're also going to hear from a radiologist who is at the forefront of the debate over which is a better diagnostic tool, the mammogram or an MRI. We'll learn about a program through the Genesee County Health Department for women who may not be able to afford a regular mammogram or exam. And finally, we'll learn how you can get involved. There are a number of fundraising walks scheduled for October, which is Breast Cancer Awareness Month. I'm Christina Burkhart, and we hope that you can join us. Newsmaker begins in just a moment. Welcome to Newsmaker. I'm Christina Burkhart. October is Breast Cancer Awareness Month, a time to learn about and prevent breast cancer. Joining me now is Dr. David Strahle, a radiologist and president of Regional Medical Imaging, and also Marcia Smith, Hurley Medical Center's breast health navigator and a breast cancer survivor herself. Thank you both so much for being here today. Now, Marcia, let's start with you. How did you discover that you had breast cancer?
I was actually having a routine mammogram. It was a little bit late in the season. I had missed it in October, but it was November. I'd had a normal mammogram and was talking to a radiologist at the tumor board and just asked them if they had the results. She responded no, and so I said, go back and check my mammogram and just call me. So she did, and she said, you have a perfectly normal mammogram. I'd had no palpable masses. She said, but we don't like your kind of breasts. They're dense, fibrocystic, and it's what we can't see that concerns us. And so I asked her what I would do, and they recommended an MRI. Because insurance won't cover MRIs for a normal mammogram, and then, I didn't have a mass, I asked them what the next step was, and so at Regional Medical Imaging, they suggested that I go ahead and have the MRI, which I did, and it was during that MRI that they discovered the breast cancer.
Wow. Wow. No, Dr. Strahle, how common is a story like Marcia's?
Well, if the woman has dense breast tissue, it's very common. For years, all we've had is mammograms to try and fight this disease, but now we have new technology and new software, and we now think we can have make a major impact on survival against this disease. Dense breast tissue is a big problem. There are bills across the United States to try and force the radiologist into putting density on the reports. The reason why they haven't done it in the past because there weren't any higher level studies that would make a difference. About 2007, I came up with the idea that we knew MRI was much more sensitive, but I came up with the idea that maybe we could cut the costs on this, shorten the study, and use it as a screening tool. That led into a $1 million grant that we received to actually do research on this that we just completed. And the results are rather astonishing. In women with dense breast tissue, MRI is clearly superior to mammograms. With women with fatty breasts, the mammogram does a very good job. So we discovered that we didn't need to necessarily replace all of mammograms with MRI, just a portion of them, which was about half the people. Half the people have dense breast tissue at any one time, half the women, and as they get older they involute, is what the word is, down to fatty breasts, which makes visibility, if you will, using a mammogram much better and increases the sensitivity much higher in the mammogram. So you don't need to spend the extra money to scan women who have fatty breasts with MR, but the women who do not, we're now realizing we have to use MR to really take a good look at what's going on. Our research allowed us to cut the costs down by under half, which is going to make a big difference now.
And now, how does a female know if she has dense or fatty breasts? Is there a way that maybe a doctor can tell her that, or is there testing that can be done?
If it's not on her mammogram report, she should go back to her radiologist and just say, would you please just amend the report and add a sentence that tells me how much dense breast tissue I have. If they report 50% or greater, then she should consider a higher level study such as breast MRI. We're pushing across the United States to screen every woman with dense breast tissue routinely. And that has led a lot of interest across the country, and especially with insurance carriers, because by finding this disease very early, I call it super early is the term I've coined, the costs of all of the treatments dropped significantly, much less to even pay for all of the MRIs in these women. So we're very excited about this new approach, and we've actually, at Regional Medical Imaging, we've been scanning women with dense breast tissue 2 years this week, in fact. And the results are astonishing. We're picking up cancers up to 6 years sooner by screening with MRI than by mammograms in women with dense breast tissue.
Wow.
And that should have a major impact on survival.
That is unbelievable. That's amazing. Now, Marcia, you've helped countless women after their diagnosis. What's your role on their journey as they go through the experience of having breast cancer?
I start off with most women diagnosed. I educate them. I always say my role is to educate, advocate, and support. So I educate women with a PowerPoint. I do a one-on-one session if they're available to come in, or I meet them pre-operatively or post-operatively to just help them understand what their pathology means, what kind of treatments they would be a candidate for. I do co-facilitate support groups, and I do lots of fundraising to create a resource that actually helps these women pay for bills that put them in financial trouble sometimes during the journey.
So what sorts of things does Hurley have set up to help women going through breast cancer? Do they have programs, support groups, anything like that?
We do. I again educate the women. I meet them pre-operatively and post-operatively with a recovery bag. So I actually have tools to help them: drain pouches, pillows, exercises. We do have a fundraising event so we do have a foundation fund that helps women financially. And we also have support groups at Genesis Hurley Cancer Institute, where we have a regular group that meets the first and third Tuesday, and a metastatic group that meets the second and fourth Thursday to help women actually work through their challenges, talk about how to prevent it, and just how to live with the late effects.
And what would you say to young women out there to encourage them to do the self-breast exams to try and prevent this happening?
I would say there has been numerous debates over whether or not women should actually do self-breast exams. I would tell everyone that they should absolutely know their breasts. They should be familiar with their nodes up in this area. Most cancers happen in the upper outer quadrant. Check your armpits, your inner mammary nodes, and make sure you are doing self-breast exams, because numerous lumps and bumps are caught on self-breast exams. We've even had women who've had lumps up in their upper chest area that were actually cancerous. So don't dismiss any lumps in your chest area or in your lymph nodes and go see a physician. You'd rather rule something out than take a chance and leave it and have it become more metastatic.
Okay, great advice. Now, Dr. Strahle, you're headed to a large symposium soon. Tell us a little bit about your research and how remarkable this research is here in Flint.
Well, we first presented at the national meeting in Chicago 2 years ago, where it was sort of a big surprise to everyone, and I was fortunate to be asked to go upstairs and talk to the head person of the entire conference. Now, this conference is the largest medical conference in the world of any type. So I was very lucky to have that break, and since then we've worked very hard on the research, completing it. The paper is going to be published soon, and they've asked me to come back now as a guest speaker and not talk just for 15 minutes, but for a full hour to the assembly in Chicago in December. So very excited about that. This meeting brings people in from all over the world. 70,000 people come to this conference.
Wow. Well, thank you both for being here today. You can find more information about Hurley's breast cancer programs under the See It on TV section of our website, ABC12.com. Up next on Newsmaker, an option for women who may not have the means to keep up with their breast and reproductive health. We'll be right back.